Hemorrhoids, also known as piles, are a common but often misunderstood condition affecting the lower rectum and anus. They occur when the veins in these areas become swollen and inflamed, leading to discomfort and sometimes pain. One of the primary causes of hemorrhoids is excessive straining during bowel movements, which can result from chronic constipation or diarrhea. Prolonged sitting, especially on the toilet, can also increase pressure on the veins, making them more susceptible to swelling. Additionally, pregnancy is a significant risk factor due to the increased pressure on the pelvic region and hormonal changes that weaken the veins. Symptoms of hemorrhoids can vary depending on their severity and location. Internal hemorrhoids, which develop inside the rectum, may not cause noticeable pain but can lead to bleeding during bowel movements, often seen as bright red blood on toilet tissue. External hemorrhoids, located under the skin around the anus, can cause itching, swelling, and sharp pain, particularly when sitting or during bowel movements. In some cases, a blood clot may form in an external hemorrhoid, resulting in a thrombosed hemorrhoid, which is particularly painful but not dangerous. Early diagnosis is crucial to managing hemorrhoids effectively and preventing complications. Ignoring symptoms or delaying treatment can lead to worsening conditions, such as prolapsed hemorrhoids, where internal hemorrhoids protrude outside the anus, or chronic blood loss leading to anemia. Understanding the signs and seeking medical advice promptly can help individuals receive appropriate care and avoid unnecessary discomfort. Simple lifestyle adjustments, such as increasing fiber intake and staying hydrated, can also play a significant role in both prevention and management. By recognizing the early signs and addressing the underlying causes, individuals can take proactive steps to maintain their rectal and anal health. Hemorrhoids often begin with subtle but noticeable symptoms that, if recognized early, can prevent the condition from worsening. One of the most common early signs is discomfort or a feeling of fullness in the anal area, especially during or after bowel movements. This may be accompanied by mild pain or irritation, which can worsen if left untreated. Swelling around the anus is another telltale sign, as the veins become inflamed and may form small, tender lumps. These lumps can sometimes be felt externally or may remain internal, causing a persistent sensation of pressure. Bright red blood on toilet tissue or in the toilet bowl is a key indicator of hemorrhoids, often resulting from straining during bowel movements. While the sight of blood can be alarming, it's usually minor and stops quickly. However, ignoring this symptom can lead to more severe bleeding or complications like thrombosis, where a blood clot forms in the hemorrhoid, causing intense pain and swelling. In some cases, untreated hemorrhoids may prolapse, meaning they protrude from the anus and require manual repositioning or medical intervention. Recognizing these symptoms early allows for prompt action, such as dietary changes, increased hydration, or over-the-counter treatments. Paying attention to discomfort, swelling, or bleeding ensures timely management and reduces the risk of complications. If symptoms persist or worsen, consulting a healthcare provider is essential to rule out other conditions and receive appropriate care. Early awareness and intervention are crucial for maintaining comfort and preventing hemorrhoids from becoming a chronic or severe issue. Hemorrhoids develop when the veins in the lower rectum and anus become swollen and inflamed, often due to increased pressure in the area. One of the most common causes is chronic constipation, which leads to straining during bowel movements. This straining puts excessive pressure on the veins, causing them to stretch and bulge. Similarly, diarrhea can also irritate the anal region and contribute to hemorrhoid formation. A low-fiber diet exacerbates the problem by making stools harder and more difficult to pass, further increasing the likelihood of straining. Obesity is another significant risk factor, as excess body weight places additional pressure on the pelvic veins. Pregnancy is a common trigger for hemorrhoids, particularly in the third trimester, when the growing uterus presses on the veins and hormonal changes weaken the vessel walls. Additionally, prolonged sitting, especially on the toilet, can hinder blood flow and worsen vein swelling. Occupations or habits that involve long periods of sitting, such as desk jobs or excessive screen time, can contribute to this issue. Other risk factors include aging, as the tissues supporting the veins weaken over time, and a sedentary lifestyle, which slows digestion and increases constipation risk. Heavy lifting or intense physical exertion can also strain the pelvic area. Genetics may play a role, as some individuals inherit weaker venous walls. Understanding these causes empowers individuals to make informed lifestyle choices, such as increasing fiber intake, staying active, and practicing proper bowel habits to reduce their risk of developing hemorrhoids. When experiencing symptoms like rectal discomfort, swelling, or bleeding, it's important to seek a professional diagnosis. A healthcare provider will typically begin with a physical examination of the anal region to check for visible signs of hemorrhoids, such as swollen veins or external lumps. If internal hemorrhoids are suspected, they may perform a digital rectal exam or use an anoscope, a small lighted tube inserted into the rectum to visualize the area more clearly. These procedures are usually quick and cause minimal discomfort. Early consultation is crucial because it helps differentiate hemorrhoids from more serious conditions like colorectal cancer, anal fissures, or infections, which can present with similar symptoms. Your doctor may ask about your medical history, bowel habits, and lifestyle to identify contributing factors. In some cases, additional tests like a colonoscopy might be recommended, especially if there's concern about underlying issues or if you're over 50 or have a family history of colorectal cancer. Don't delay seeking help out of embarrassment. Hemorrhoids are a common issue, and healthcare providers are trained to handle them with professionalism and sensitivity. A timely diagnosis ensures you receive the right treatment plan, whether it's lifestyle adjustments, medications, or further procedures. Ignoring symptoms can lead to complications like worsening pain, thrombosis, or prolapse, making early intervention all the more important for your comfort and health. Hemorrhoids can often be managed effectively with a variety of treatment options tailored to the severity of the condition. For mild cases, over-the-counter treatments such as creams, ointments, or suppositories containing hydrocortisone or witch hazel can provide relief from itching and swelling. Fiber supplements, like psyllium husk, can soften stools and reduce straining during bowel movements, which helps alleviate symptoms. Warm sitz baths. Soaking the affected area in warm water for 10-15 minutes several times a day can also soothe discomfort and promote healing. For more persistent or painful hemorrhoids, minimally invasive procedures may be recommended. Rubber band ligation is a common outpatient procedure where a small rubber band is placed around the base of the hemorrhoid to cut off its blood supply, causing it to shrink and fall off within a few days. Similarly, sclerotherapy involves injecting a chemical solution into the hemorrhoid to shrink it, while infrared coagulation uses heat to coagulate the blood vessels, reducing the swollen tissue. These procedures are relatively quick, require little downtime, and are effective for many patients. In severe cases where hemorrhoids are large, prolapsed, or unresponsive to other treatments, surgical intervention may be necessary. A hemorrhoidectomy involves the surgical removal of excess tissue and is typically reserved for extreme discomfort or complications like thrombosis. Another option, stapled hemorrhoidopexy, repositions and staples the prolapsed tissue back into place. While surgery offers a more permanent solution, it requires a longer recovery period and may involve post-operative pain management. Consulting a healthcare provider ensures the right treatment plan is chosen based on individual needs and severity. Preventing hemorrhoids starts with making mindful lifestyle choices that promote digestive health and reduce strain on the rectal veins. A high-fiber diet is essential, as it softens stools and eases bowel movements, minimizing the need for straining. Foods like whole grains, fruits, vegetables, and legumes should be staples in your meals. Incorporating fiber supplements, such as psyllium husk, can also help if dietary intake is insufficient. Staying hydrated is equally important. Drinking plenty of water ensures stools remain soft and easy to pass, reducing the risk of constipation, a major contributor to hemorrhoids. Physical activity plays a key role in prevention. Regular exercise, even simple activities like walking or swimming, improves circulation and prevents blood from pooling in the pelvic area. Avoiding prolonged sitting, especially on the toilet, is crucial. Sitting for extended periods increases pressure on the rectal veins, so take breaks to stand or move around if you have a sedentary job. When using the toilet, avoid straining or spending excessive time on the toilet, as this can worsen hemorrhoid symptoms. Proper bowel habits are another cornerstone of prevention. Respond promptly to the urge to defecate, as delaying can lead to harder stools and increased straining. Establishing a consistent routine, such as visiting the toilet at the same time each day, can help regulate bowel movements. Lastly, practicing good hygiene by keeping the anal area clean and dry reduces irritation and the risk of infection. By adopting these strategies, you can significantly lower your chances of developing hemorrhoids and maintain long-term rectal health. Long-term management of hemorrhoids requires a commitment to healthy habits and proactive care to prevent recurrence and maintain comfort. After initial treatment, it's essential to continue a high-fiber diet rich in fruits, vegetables, and whole grains to promote regular bowel movements and reduce straining. Staying well hydrated by drinking plenty of water further softens stools, easing their passage. Avoiding prolonged sitting or standing, especially on the toilet, minimizes pressure on the rectal veins, while taking short walks or stretching breaks can improve circulation. Regular exercise, such as walking, swimming, or yoga, helps maintain a healthy weight and reduces the risk of constipation, a key contributor to hemorrhoids. Practicing good bathroom habits, like responding promptly to the urge to defecate and avoiding excessive wiping, can prevent irritation. Over-the-counter remedies, such as witch hazel or soothing creams, may provide occasional relief during flare-ups. However, persistent or worsening symptoms should prompt a visit to a healthcare provider to rule out complications or other underlying conditions. Follow-up appointments with a doctor are crucial for monitoring progress, especially for individuals with chronic or severe hemorrhoids. These check-ins ensure that treatment remains effective and allow for adjustments if needed. Keeping a symptom diary can help track triggers and identify patterns, enabling better management strategies. By integrating these practices into daily life, individuals can achieve long-term relief and reduce the likelihood of future hemorrhoid episodes, maintaining overall rectal health and quality of life.